Hi. Just waiting for some folks to hop on. I'm turned around in a different way than I normally am. I usually have a stand and I didn't put it up today, so a change of scenery, if you will. Okay, so we're right at about 100, and in the interest of time, we'll go ahead and get started. I actually have a fair bit today. So just kind of first to talk a little bit about the status. We are at 55, unless we get some cases reported between now and the end of the day when we report out those cases. Again, we're reporting those Monday through Friday at approximately 4 p.m. Also on our website, on Twitter. We do have 7 active cases, so remember that 55 is the amount that has been reported since the first case, which was on March the 22nd, and the majority of those have been released from isolation. So 7 active cases out of those 55. That 55 number, it's always going to grow. That's how we report other communicable diseases as well, but the question that's been posed to us pretty often is, what numbers should we be looking at? That's not exactly an easy answer, but active cases is a good place to start from the data that you're seeing every day on Facebook or the website, wherever you're viewing that. So active cases is always a good indication of where you're at and active cases over time, and we are tracking that. So in general, active cases, the most we ever had on one given day was like 17 or 18 back in early April. And we're really still kind of hovering around, 5 to 8, 9. We're kind of staying in that area at this time. We also look at some other things. So a rolling 3-day average and a rolling 7-day average. And I think I talked about this a couple weeks ago on live, but what that is the 3-day and 7-day. On today, if I'm going to look at my rolling 3-day average, I'm going to look at the cases that were reported today, yesterday, and the day before. I'm going to divide that by 3. And what that really does is takes out some of that variability of, yesterday we had 4 cases and the day before we had 0, and maybe the day before we had 1, and I'm just giving arbitrary numbers here. But that takes out some of that variability. Yesterday we had 4 cases reported. We've had 4 cases reported in a single day only 2 other times, and that's the most that we've had reported in a day is 4. But again, we need to keep in mind that we're dealing with really small numbers. And so, we'll see what today brings. Obviously, it looks like we're not going to have any new cases reported today, but we'll just see what happens between now and 4 o'clock. Some of the other things that we look at are percent increase. So what is the increase in the way of cases from yesterday to today? Looking at weekly cases reported, that's on our website right now. So we look at, Sunday through Saturday, how many cases were reported in that week. Again, kind of going back to April where we were first kind of seeing that initial increase, and when there was a lot of different things happening. 11 is the most that we've had reported in a week. And again, we're kind of staying steady. It's been like 3, 5, 5, 4. And then again, we'll wait to see what happens the rest of the week. And then some other things we look at is positivity rate of testing. And right now that's about 2 to 3%. Again, depending on what part of the data you look at, but overall 2 to 3%. So still pretty low. We do not have indications of widespread community transmission. We've had some recent cases that have been, unable to identify the source. And sometimes that can change too as we're doing our investigation. We learn more about the case, or, they say something that, makes us put a connection in place with another case, or they learn more about maybe an exposure they had. But we have had some that have been community acquired, or what we would say is we don't know where the transmission came from. So they didn't travel, they weren't connected to another case. And so those things are important to know. But we are not seeing widespread community transmission. Our healthcare capacity is really good right now. So all of those things are good, But again, we want to continue taking precautions, and I'm going to talk a little bit more about that here in just a minute. Excuse me. We've tested almost 2,700 people. We'll report out that testing number today as well. And when I say we, I mean the county. That's St. Francis County residents that have been tested. And so, again, as testing increases, the more testing you have, the more you're going to find cases. And that really is part of the objective in testing. So that's good news as well. I want to talk a little bit about antibody testing and how that figures into counts. And I've seen a couple questions come through about antibody testing. We've talked a lot about that. Antibody testing is not recommended for diagnostic use. It is recommended for public health surveillance only at this time. That's not to say that in the future that we won't use antibody tests to help diagnose. But right now, it is not recommended to use antibody tests to diagnose. That being said, that has been used at times by some physicians or some offices. And really, again, we have to take into context what's happening with the case. For example, if we have a case who is a contact to another case, so we know they were exposed, and for some reason the office doesn't test with that PCR test, which is the nasal swab, and they do that blood test, the antibody test, and it's positive, we can reasonably say, and again, there's criteria for this that is set forth by an epidemiology board. We can reasonably say that that is likely a case, and we want to treat it like a case because we want to isolate and we want to quarantine. And the other side of that would be that, maybe you have a positive antibody, but you've never had any symptoms. And so we know there's asymptomatic infections and that type of thing, but it's not a confirmatory test. And so there's a little bit of, again, doing some deeper digging to find out, were they symptomatic? When were they symptomatic? Were they exposed? When it comes to antibody test, the PCR test, the nasal swab, is a confirmatory test. It tests for genetic material of the virus. So I just wanted to talk a little bit about antibody testing and why you see those counted in our counts. Now, some of those folks that if they don't meet the criteria because they got an antibody and maybe they said, they were sick back in March and they're not sick right now and they don't end up getting counted, they might get counted in the future. We take those and we keep those and we keep a list of them. But if they don't meet the state criteria right now, it may change if the state criteria changes, because that does happen at times. So I just wanted to kind of talk about that because I know you're seeing those serology breakdowns on our reporting every day. I also wanted to mention that the antibody test, there's two parts of the antibody test. There's the IgG, which typically points to a past infection, so somebody that's already been over an infection. And then there's the IgM, which sometimes means that they are in an early infection and sometimes not. There's also antibody tests out there right now that if you read about their testing online, it says that it can pick up antibodies for other coronaviruses. And so that's why, again, antibody tests are not recommended for diagnostic use. I really have a lot today. I'm probably going to go over, and I'm sorry if you get bored and want to watch the rest of this later, then you could do that. Phase 2, I want to talk a little bit about that. The governor announced that, Missouri is fully open. So locally here in St. Francis County, there are no public health orders for our county. Right now, every business can be fully open, and, really it's coming back to that personal responsibility, because really the guidance and recommendations are pretty much the same. We did update some of our guidance on the website, and you can take a look at that. And mainly it was a lot of more so wording types of things, because it's still recommended to practice good hygiene and masks in public places, especially where you can't social distance. All of those things are still recommended. So really again, it's coming down to personal accountability and personal responsibility. I'm going to talk about some things that we're working on here in just a minute, but I just wanted to kind of touch on that there are no local mandates, but we have released guidance and we support CDC guidance as well. Get a lot of questions about, is it safe to this? Is it safe to go swimming? Is it safe to go to the grocery store? there is no way to take the chance of getting COVID-19 down to zero. It's not possible. What you can do is if you're going out into a variety of public places, the CDC has guidance for many of those. And then also, again, going back to those general guidance things that we've talked about and that you can view that guidance on our website, but, social distancing, hygienic practices, staying home when you're sick. There's just no way to take that down to zero because the virus is out there. And so we just have to do our absolute best, and we have to evaluate our own personal risk or the risk of people that we spend time with. And that's something that, again, we all kind of have to evaluate on our own or for ourselves right now. Again, we're not seeing widespread community transmission, and so that's a good thing, but we can't become, again, too relaxed, too complacent, because there is a transmission of this virus occurring. And so, I would just encourage you to continue to be diligent and continue to, do those diligent practices. Close contacts. We had a lot of questions recently about, I was in contact with somebody who was in contact with somebody who was in contact with a confirmed case. A close contact is someone who is directly in contact with a confirmed case, and that is defined as being within 6 feet for at least 15 minutes of a confirmed case. All persons should continue to watch for signs and symptoms of COVID-19 and stay home when they're sick and call their healthcare provider if they think they have COVID-19 and need to be tested. But the people who are quarantined or people who need to quarantine after an exposure are people who are exposed to the case. So again, within 6 feet for at least 15 minutes. I'm trying to hurry through this. I want to talk a little bit about some of the things that we're working on. Obviously, continued investigation and surveillance is our number one priority. That way we can have a good idea as to what community transmission looks like and what the projections look like and the trends. And you've heard a lot about, again, contact tracing and disease investigation. And so that's our number one priority because that's what we do. We are also working on some community status indicators. If you take a look at Jefferson County Health Department's Facebook, they've got a really good system in place, and it's something that we've been discussing too, of a red, yellow, green system. So similar to something where you'd see like air quality or beach safety, something to give kind of more of a simplistic guidance as to here's where we're at as a community. And that would be correlated with CDC criteria and the national guidelines as well. I think that'll be rolled out in the next couple of weeks, but we're still working on finalizing some of those documents and those recommendations. Providing technical assistance. So we provide technical assistance to all sectors of the community for guidance and how they can prevent infections in their workplace or their business or their homes. Again, we support CDC criteria, but we certainly offer that technical assistance and are actively working with the schools at this time especially. We are planning for the potential for a vaccine. That is a strong possibility, and it's something that, we always work on mass vaccination, but it's something that could happen in the future. And, the earliest that they're thinking that would be possible would be fall 2020. Fall 2020. So just a couple of months from now, but it would be very limited and very reserved for people who are at risk. And I'm not saying that that's for sure. I'm just saying they want us to be planning for it. So we're working on that, and then also, again, working on, the potential for a mass vaccination of the general population in early 2021. Again, these are just dates that the state has given us to really start planning and thinking about. Nothing's set in stone. And then we are also working on the potential for testing in the future here at the health center. I will tell you that staffing is an issue. We really do not have the staff at this time, and we'll be looking for approval from the board for an additional nurse, and then they would be paid for under CARES Act funding temporarily. So there's a lot of things we got to think about in that, but that is, we are looking to potentially test in the future. Again, we don't have a doctor on staff, but it would be strictly testing. So We are not testing now, just potentially in the future. And we'll let you know, as these things happen, we'll have that communication out there. And then, we're headed back to kind of some of our normal operations here in the health center. Environmental's back out in the community and is conducting all of their their inspections. All of our clinical services are up and running as far as the nurses go, by appointment only. And I cannot stress enough to get in for back to school shots. I do not think we are going to have walk-in clinics. I'm 99.9% positive we will not have walk-in clinics this year. We see hundreds of people. We gave 6,000 shots last year, and a quarter of those were in the month of August. And so I cannot stress enough, now is the time. If your kid is starting kindergarten, 8th grade, or 12th grade, there are required immunizations, and please call us for an appointment. And then WIC is working on reopening to their clients for in-person visits. They're still conducting their normal services, but via phone and mail, and that will probably happen in July. And as those things happen, we'll let you know. Wanted to hit on just kind of going back to those general interventions that we've talked about a lot. The best way that we can control COVID-19 at this time without a vaccine really is by being personally responsible. And that's a choice that we all have to make, what we're going to do. And really that is staying 6 feet away from other people. Wearing a mask when you're in public places where it's difficult to social distance. And remember, when you wear a mask, it's not so much about you as the person. It's not so much about Amber. It's about the people around Amber and the community. And then washing your hands and being diligent, staying home when you're sick. These symptoms are vague. And if you look at the list, it kind of just keeps getting longer. Fever, chills, shortness of breath, fatigue, muscle pain, body aches, headache, sore throat, new loss of taste or smell, runny nose or congestion is on the list. Diarrhea, nausea, vomiting. So those are symptoms of a lot of different things, but those are also symptoms that we would say you need to stay home and monitor yourself. Call your doc and see if they suggest that you get tested. And I know that's easier said than done for some folks, but that is what we would suggest. And what I would say is some of our recent cases have not quite picked up on some of those symptoms because they're so vague, and only you know you and what's normal for you. And so I would ask that you just do that daily self-evaluation. I know some of you are probably being screened at your place of work or wherever you're going, and so please continue to do that and just be really self-aware. I'm trying to make sure that I hit everything, and I know I'm over, and I want to go try to hit some of these questions. I want to talk about a lot of folks had questions or concerns, and there was kind of this big uproar about the World Health Organization and what they had talked about asymptomatic infections. And they kind of retracted that and went back and kind of clarified that. And what I would say is pre-symptomatic is different from asymptomatic. So pre-symptomatic is that, this case is asymptomatic now, but develop symptoms in the future. So those people are much more likely to spread this disease than asymptomatic people. So people who never show any symptoms and are not symptomatic at the time of test. Those are two different things. And, I think that was really what the World Health Organization came back and kind of clarified. But again, this is even more important, again, for masks and just being really diligent about those things. And I know there's been some changes in masks, and, late March, there was this recommendation that, we don't suggest wearing masks, but, better science refutes science. And so the more we learn, things are going to change. And we see that in other parts of medicine and other technology and all of those things. So better science refutes science. And so, the recommendation is that you wear a mask in public places if you can. There's some exceptions to that. And again, I would refer back to CDC guidance. I'm going to try to go back through. There really isn't a ton of questions coming in. Hospitalizations, there's been 8 hospitalizations out of the 55 cases. No further deaths. We'll report that out. Does that 2,700 number include state employees at various state agencies in the county? Yes. If they live in our county, that testing number will count for our county. Yes. Does DOC cases account if they reside in our county? So the inmates do. So yes, they will most of the time. Sometimes if it's a case that's kind of passing through ERDCC, it might not, and it might count for the jurisdiction that they're either going to or that they came from. It really depends on where they're at. But the majority of the time, yes, they are counted for us. Employees, no, if they don't live here. So just because they work here doesn't mean they're counted for here. But if they live here, they're counted. Would you see a COVID test that was taken yesterday if it was positive today? If it's been reported to us, that it gets reported from either the state or the hospital, the lab, the doctor's office. So if it gets reported to us, then we would know about it that way. I hope I'm answering that right. I'm sorry, I'm way over. I haven't seen any tests being offered, and how are we doing contact tracing? So the testing is done in the doctor's office. And then there's been some state testing happening around the state. We have a list of testing sites on our website. Contact tracing is the same as what we do for other communicable diseases. And so just as an example, if I am COVID positive, we do the disease investigation. And when we talk to that person, we say, we need a list. Who have you been around we start 2 days before symptom onset. And so who have you been within 6 feet for at least 15 minutes? And then we get that list, and then we call all those people and say, you've been named a contact to a confirmed COVID case, and here's the things you need to do. So that's really the shortened version of how that works. But in general, that's typically the way it works. Now, we also ask about employer and, have you been to church, or, really trying to think, because it's hard. I mean, when, you sit and try to think about all the people you've been around, and that's another reason for social distancing. Because really right now, it's the best case scenario that you know exactly who you've been in contact with. Again, that helps prevent transmission in the community and further cases. So that's really, again, in a nutshell, how contact tracing works. If I wore a mask and took someone to get tested for COVID, do I have to quarantine myself? I would ask, is that person positive? And so we are not legally able to quarantine people unless they are contacts to confirmed cases. But what I would say is, if you took somebody who you think has COVID-19, the best case scenario is that you go ahead and quarantine until that test result is available. And certainly if that test comes back positive, then you would, be asked to quarantine. I think we need some more information on maybe what's happening there, and I would encourage you to give us a call. But best case scenario is that you go ahead and quarantine until you know about if that person's positive or not. All right, I think I got to everybody. I'm so sorry for going over, and this probably got really boring for you because it's been a long video. But thank you for being on, and thank you for continuing to tune in. We'll do this every 2 weeks for now, so I'll be back on July the 2nd. Yes, July 2nd. So thank you. If you have questions, concerns, please reach out to us. We're also doing some kind of FAQs on Fridays now that our intern from Truman is working on. So we're really, really blessed to have her. And again, hang in there, and we're going to move forward as a community, and as information becomes available, and as we kind of start some of these other projects and information for the community, we will put that out there to you all. So appreciate it. Thanks.